Hi everyone, this video is part 5 of the 5A series for AP Psychology students. This particular video will focus on identifying causes and symptoms of personality and eating and feeding disorders. So as you can see, we are still in that section titled Selection of Categories of Psychological Disorders. But this is the final video in this series, so I will finish up the remaining categories and disorders you need to know for the AP Psychology exam. So today's video, like the previous, will focus on the major theme of symptoms and possible causes, and this will be for the categories of disorders that are personality and eating and feeding disorders. These are the vocabulary concepts that you should take note of while watching today's video. By the end, you should be able to define and describe them. Personality disorders are long lasting patterns of thinking, feeling, and behaving that are different than what's expected from a person's culture or causing distress or dysfunction to their everyday life. And unlike regular personality traits that may change in different situations, personality disorders are very rigid and can cause problems in relationships and work and everyday life. These disorders usually start in the teenage years or early adulthood and continue over time. Based on the diagnostic interview data from the National Comorbidity Study replication published in the National Institute of Mental Health, it's believed that about 9% of the population has at least one personality disorder. The DSM 5 categorizes personality disorders into three clusters based on shared characteristics. The first cluster of personality disorders is called Cluster A, and Cluster A disorders are similar because they share characteristics that are considered odd or eccentric. And these individuals exhibit social withdrawal, suspiciousness, and atypical thought patterns. The first is paranoid personality disorder. Paranoid personality disorder is marked by a deep distrust and suspicion of others, even when there's no real evidence. People with paranoid personality disorder often believe that others intend to harm them, deceive them, exploit them, and this leads to chronic wariness and difficulty maintaining relationships. Diagnosis requires at least four of the following symptoms. One is unjustified suspicion, so believing that others are deceiving or trying to harm them. The second is doubts of loyalty, so viewing friends or coworkers as untrustworthy. The third is reluctance to confide in others, so fearing giving out personal information because maybe it will be used against them. Next is reading hidden meanings into remarks. So this would be like perceiving harmless comments as insults or threats. Another symptom would be holding grudges, so being unwilling to forgive perceived wrongs. And then also seeing attacks that aren't actually there. So this would be like overreacting to imagined slights with anger. Another symptom would be unfounded suspicions of infidelity. So, constantly suspecting a partner of cheating without proof. So, paranoid personality disorder is different from psychotic disorders, even though it has a little bit of that similarity of paranoia. But unlike the delusions that you might have in schizophrenia spectrum disorders, paranoid personality disorder does not involve clear delusions or hallucinations, and the paranoia is much less severe, but it is persistent. The next cluster A personality disorder is schizoid personality disorder, and this is characterized by a detachment from social relationships and a limited range of emotional expression. People with schizoid personality disorder prefer solitude and show very little interest in forming close relationships, including with family. Diagnosis requires at least four of the following symptoms: a lack of desire for close relationships and preferring solitude over social interactions. The second is choosing solitary activities. So, this might be enjoying hobbies that are alone, that don't involve others at all. Another symptom would be indifference towards romantic relationships or little to no interest in intimacy. Another symptom is having few different pleasures or finding few things enjoyable and exciting. Another would be having a lack of close, meaningful friendships. Another symptom would be emotional coldness or flat affect. And an important clarification for this particular disorder is, unlike social anxiety disorder, people with schizoid personality disorder are not distressed by social interactions. They just simply don't desire them. Causes of schizoid personality disorder is believed to result from a combination of genetic factors and a childhood environment lacking emotional warmth and social connection. The next cluster A personality disorder is schizotypal personality disorder. This is characterized by eccentric behavior, unusual thinking, and difficulty forming close relationships. While it does share some features with schizophrenia, it does not involve full psychosis. So there's no hallucinations or delusions. Diagnostic criteria for schizotypal personality disorder means that they need to have at least four of the following symptoms. One would be something called ideas of reference, and this means that they believe that random events might have personal significance. So they might see a street sign and believe that it's a message meant for them. Another symptom would be holding odd beliefs or magical thinking. So this might look like holding superstitious or paranormal beliefs. Maybe they believe that they have telepathy or a sixth sense. Another symptom is unusual perceptual experiences. Another symptom is odd thinking and speech. So maybe speaking in unusual or vague or overly elaborate manners. Another symptom is suspiciousness and paranoia, as well as inappropriate or limited emotional expression. But one thing that's really important about this particular disorder is that it involves eccentric behavior, possibly even appearance, like dressing or acting in an unconventional way or manner. Other symptoms include a lack of social relationships and persistent social anxiety. Although individuals with schizotypal personality disorder have unusual thought patterns, they don't have full blown delusions and hallucinations like schizophrenia. Causes are believed to have different links, possibly genetic. Possibly childhood adversity like neglect or social isolation as well. Next are cluster B personality disorders. Cluster B personality disorders involve dramatic, overly emotional, or unpredictable behaviors that often cause difficulties in relationships. People with cluster B disorders may struggle with impulse control, intense emotions, unstable self image, and difficulty maintaining healthy connections. Antisocial personality disorder is characterized by having persistent disregard for the rights of others, and this might involve deceit, manipulation, or lack of remorse. To be diagnosed, an individual must first be 18 years old, but they must exhibit at least three of the following behaviors before the age of 15. These are repeated law breaking, so engaging in illegal activities like theft or violence, or deceitfulness, like lying or using fake IDs or manipulating others for personal gain, or impulsivity, so acting without considering consequences, or irritability and aggression, so frequently getting into fights or displaying violent behavior, or reckless disregard for safety, whether it's endangering themselves or others without concern, or irresponsibility, so failing to maintain employment or meeting financial obligations. The biggest one is lack of remorse, so showing no guilt or remorse for others and for harming them and not feeling that guilt. Some really key considerations for antisocial personality disorder are that it cannot be diagnosed before the age of 18. Symptoms must have started, though, in childhood or early adolescence, and in those ages, it might be described as conduct disorder. Not all individuals with antisocial personality disorder are violent. Some engage in manipulation rather than overt aggression. And also, not all criminals have antisocial personality disorder. Causes are linked to genetics, brain differences affecting impulse control, and childhood factors like abuse and neglect. Next is histrionic personality disorder, and this is characterized by excessive attention seeking and emotional expressiveness. Individuals with histrionic personality disorder often feel uncomfortable when they're not the center of attention and may act dramatically or seductively to gain attention or to get people to notice them. To be diagnosed, an individual must exhibit at least five of the following behaviors: a desire to be the center of attention. The second is inappropriate, seductive, or provocative behavior. A third is shallow, rapidly shifting emotions. Next is excessive focus on appearance. Another symptom is dramatic or theatrical speech, speaking in an exaggerated way. Another symptom is being easily influenced by others. Another symptom is misinterpreting relationships. Key considerations for histrionic personality disorder is that it goes beyond just being outgoing. Individuals with histrionic personality disorder really have a deep sense of need for attention and may go to great lengths to get it. Unlike narcissism, those with histrionic personality disorder are seeking approval rather than like superiority. So they want to be liked, not necessarily just admired. So their emotions can appear intense, but lack depth and shift quickly. Next is narcissistic personality disorder. And this is characterized by an inflated sense of self importance and a deep need for admiration and a lack of empathy for others. Despite appearing confident, individuals with narcissistic personality disorder often have a fragile sense of self esteem and react very poorly to criticism. To be diagnosed with narcissistic personality disorder, an individual must exhibit at least five of the following symptoms. One is grandiosity, so exaggerating their self importance. Another is a preoccupation with fantasies of power, success, or beauty. So constantly seeking that admiration or dreaming of achieving greatness and good looks and power. Another is a belief in being special and unique. Another symptom is an excessive need for admiration and craving attention. Another is a sense of entitlement. Another symptom is exploitation of others and using other people for their own personal gain. Another symptom is lack of empathy, so struggling to understand or care about the feelings of others. Another symptom is envy of others or believing that others envy them. Another symptom is just arrogance, acting superior or dismissing others as being unimportant. Some key considerations about narcissistic personality disorder is that it's not just confidence and it involves an excessive sense of self focus and difficulty forming meaningful connections with others. While individuals with narcissistic personality disorder may appear successful, their relationships often suffer due to their own need for admiration. They react with anger to criticism due to their fragile self esteem. Causes of narcissistic personality disorder are believed to be from multiple factors, possibly stemming from genetics and early experiences, like getting excessive praise or extreme criticism from their caregivers. Distinguishing narcissistic personality disorder from antisocial personality disorder can be kind of confusing, and students often get them mixed up because they do share some overlapping traits and they do belong to the same cluster for that reason. So you can see on the screen, there are some differentiating characteristics, but I'll give a simple analogy. In antisocial personality disorder, a person might think, I want what I want, and I don't care who I hurt to get it. Whereas someone with narcissistic personality disorder, it's going to be more about like their own self-importance and admiration. So they might think like, I want to be important and I'll be mad at you if you don't admire me. So if you would take a moment and look at some of those key differences, because this is one where I find that students often get confused between antisocial personality disorder and narcissistic personality disorder. The next cluster B personality disorder is called borderline personality disorder, and this is characterized by unstable emotions, relationships, and self image. Individuals with borderline personality disorder often experience intense mood swings, fear of abandonment, impulsive behaviors, and difficulty controlling anger. To be diagnosed, an individual must exhibit at least five of the following symptoms. The first is fear of abandonment, and this might look like making desperate efforts to avoid real or imagined rejection. Another symptom is unstable relationships and moving and alternating between extreme idealization of their partner or friends to devaluation of others. So I love you to I hate you. Another symptom is unclear or shifting self image. So frequently changing goals and values and sense of identity. Another symptom is impulsivity or conducting or taking part in risky behaviors. Another symptom is self harm or suicidal behavior, engaging in hurting oneself. Another symptom is intense mood swings, strong emotional reactions that can last a few hours to a few days. Another symptom is chronic feelings of emptiness or feeling numb or that they lack a stable sense of self. Another symptom is explosive anger, intense outbursts of rage over small or minor issues. Another symptom is paranoia or disassociation. Some important considerations are that borderline personality disorder is not just mood swings. It involves difficulty regulating emotions and maintaining stable relationships. Many individuals with borderline personality disorder fear being abandoned and then react intensely to perceived rejections. Some causes and associations of borderline personality disorder is that it's believed to result from a combination of genetics and early trauma, such as neglect or abuse, and also unstable relationships in childhood. Next is cluster C personality disorders. Cluster C personality disorders are characterized by high levels of insecurity, fear of criticism, fearfulness, and difficulty with social relationships. People with these disorders often struggle with self doubt, excessive worry, and avoidance of situations that make them uncomfortable. Avoidant personality disorder is characterized by intense fear of rejection, criticism, and embarrassment, which leads to social withdrawal and extreme sensitivity to negative feedback. Unlike shyness, avoidant personality disorder significantly interferes with daily life and relationships. To be diagnosed, an individual must exhibit at least four of the following symptoms. One is avoiding social activities due to fear of criticism or rejection. Another is unwillingness to interact with others unless certain of being liked. Another symptom is holding back in relationships out of fear or shame or ridicule. Another symptom is preoccupation with rejection or criticism in social situations. Another symptom is feeling socially inept or unappealing or inferior to others. Another symptom is avoiding new activities for fear of embarrassment. And a few considerations to keep in mind is that in avoidant personality disorder, this is different than social anxiety disorder because in social anxiety disorder, this is a temporary distress that happens in a social situation. Avoidant personality disorder is a lifelong pattern of avoiding because of the fear of rejection. And it's not necessarily specific to being in that particular social situation. People with avoidant personality disorder desire close relationships but fear rejection. So they are so intensely fearful that they isolate themselves. Causes of avoidant personality disorder are believed to result from a combination of genetic predisposition and childhood experiences of rejection, criticism, and social anxiety. The next cluster C personality disorder is dependent personality disorder. Dependent personality disorder is characterized by an excessive need to be cared for, being submissive or very, very clingy outside of normal personality traits that are dependent. So, people with dependent personality disorder struggle to make their own decisions. They fear being alone and they rely very heavily on others for support. For diagnosis, individuals must have five of the following symptoms: difficulty making decisions without excessive advice or reassurance, needing others to take responsibility for major areas of life, fearing or disagreeing with others due to fear of losing their support, difficulty starting or doing things alone due to low confidence, going to extreme lengths to get support from others, even tolerating mistreatment, feeling helpless or uncomfortable when alone, fearing that they can't care for themselves, urgently seeking a new relationship when one ends to avoid being alone, and constantly fearing abandonment and needing reassurance from others. Some important notes to keep in mind is it's not the same as being dependent on a loved one. This is where it's interfering with daily functioning and it makes the person feel helpless when they don't have that constant support. People with dependent personality disorder are at a higher risk of staying in abusive relationships due to their extreme fear of being alone. Dependent personality disorder is likely influenced by overprotective or authoritarian parenting styles that discouraged independence. The last cluster C personality disorder is obsessive compulsive personality disorder. And this is a disorder that impacts personality. And this is a pattern of perfectionism, extreme orderliness and control, and often at the expense of flexibility and relationships. Unlike obsessive compulsive disorder, or OCD, which involves intrusive thoughts and compulsions, obsessive compulsive personality disorder is a personality style that affects how someone approaches life and relationships. To be diagnosed, a person has to have four of the following symptoms: a preoccupation with rules, details, lists, or organization to the point that their main goal has been lost. A second is extreme perfectionism that interferes with task completion. A third is excessive devotion to work at the expense of leisure and relationships. Another is inflexibility about morals or ethics or values. Another is inability to discard worthless objects, even those without any sentimental value. Another is unwillingness to delegate tasks unless done exactly their way. Another symptom is not wanting to spend on oneself out of fear of wasting money. Another is having very rigid and stubborn personality traits that resist change. Some important notes about OCD and OCPD is that OCD, or obsessive compulsive disorder, involves distressing obsessions and compulsions, while OCPD is about a rigid, perfectionistic way of thinking and behaving. And people with OCPD often see their behavior as correct, and they might not recognize how it's negatively impacting themselves or their relationships. Obsessive compulsive personality disorder is believed to be a result of genetic tendencies toward perfectionism combined with possibly strict or controlling upbringings. The final category of mental health conditions you need to be familiar with is eating and feeding disorders. In this particular category, you need to be familiar with two, and those are anorexia nervosa and bulimia nervosa. These disorders are related to consumption, but are rooted in psychological dysfunction. Anorexia nervosa is a disorder that involves extreme food restriction, intense fear of gaining weight, and a distorted body image. People with anorexia see themselves as overweight even when they may be dangerously underweight, leading to severe malnutrition and life threatening complications. It has a higher prevalence in girls and young women. However, there are cases in boys and men, and it's continuing to increase. Anorexia has one of the highest mortality rates among mental disorders due to medical complications and suicide risk. Diagnostic criteria for anorexia nervosa must include all of the following: significantly low body weight, intense fear of gaining weight, distorted body image, and it then can include a few of these additional symptoms: extreme food restriction, excessive exercise to prevent weight gain, obsessive calorie counting, social withdrawal and avoiding meals, and serious health risks like malnutrition, heart problems, brittle bones, and hormone imbalances. There are many different factors that contribute to anorexia. There is a family history of eating disorders that can then lead to the increased risk of developing anorexia nervosa. So there's a belief that there's possibly a genetic component. There's also believed to be brain differences. Changes in brain structure and serotonin levels may also play a role. There's also believed to be personality traits like perfectionism and high self control and a need for approval that can contribute to the development of anorexia, and also sociocultural pressures like media and cultural ideas of promoting thinness. Family environment can also play a role, like high expectations, critical attitudes, and focus on appearance. There's also believed to be other environmental factors like stress and trauma, like bullying or major life transitions that can trigger symptoms of anorexia. The final disorder that you need to be familiar with is bulimia nervosa. Bulimia nervosa is often called bulimia, and this eating disorder involves episodes of binge eating followed by behaviors to prevent weight gain, like self induced vomiting, excessive exercise, or misuse of laxatives. Unlike anorexia, people with bulimia may have a normal weight or even be slightly overweight, but they still have an intense fear of weight gain and feel a loss of control over their eating habits. Bulimia is more common in adolescents and young adults, especially in young girls and women, but cases in boys and men are increasing. While it may not cause extreme weight loss like anorexia, bulimia carries severe health risks, including electrolyte imbalances, heart issues, and gastrointestinal damage. Diagnostic criteria requires all of the following. The first is recurrent binge eating episodes. So, this is eating an excessive amount of food in a short period of time, often feeling out of control while eating. The second is engaging in behaviors to rid the body of the food. So, this would be like engaging in purging, like vomiting or laxative use, or non purge methods like fasting or excessive exercise to avoid that weight gain. Frequent occurrence is also an important symptom. So the binges and then the following behaviors need to occur at least once a week for 3 months. Excessive influence of body weight and self esteem is another component. So, self worth is heavily tied to body shape and weight. The final disorder that you need to be familiar with is bulimia nervosa. Bulimia nervosa is often called bulimia, and this eating disorder involves episodes of binge eating followed by behaviors to prevent weight gain, like self induced vomiting, excessive exercise, or misuse of laxatives. Unlike anorexia, people with bulimia may have a normal weight or even be slightly overweight, but they still have an intense fear of weight gain and feel a loss of control over their eating habits. Bulimia is more common in adolescents and young adults, especially in young girls and women, but cases in boys and men are increasing. While it may not cause extreme weight loss like anorexia, bulimia carries severe health risks, including electrolyte imbalances, heart issues, and gastrointestinal damage. Diagnostic criteria requires all of the following. The first is recurrent binge eating episodes. So, this causes of bulimia nervosa are believed to be multiple factors, including a family history puts people at increased risk. Changes in serotonin levels can cause impulse control issues and may also contribute. There's also believed to be personality traits like struggling with impulsivity and emotional instability and perfectionism, as well as social and culture pressures like unrealistic beauty standards, dieting cultures, and different things about body image and focus on looks and appearance, as well as environmental issues like family and home life, having high expectations and criticism about weight, even a history of dieting at home, as well as stress or trauma. So, stressful life events can also trigger bulimia nervosa as a coping mechanism. Now, let's finish today's video with a few short questions for review. Question number one says Mindy's friends describe her as unpredictable. One day, she tells them she feels deeply connected to them, but the next, she suddenly cuts them off, accusing them of not caring for her. She also struggles with controlling her emotions and has a history of impulsive behaviors. Which personality disorder best fits Mindy's symptoms? Question number two says Ella often believes that random events, such as news headlines or a passing car, have special personal meaning for her. She sometimes feels like she can read people's minds, although she's never been able to demonstrate this ability. Ella dresses in an eccentric way and struggles to form close relationships because she feels disconnected from others. Which personality disorder is Ella most likely experiencing? This concludes today's video on personality and eating and feeding disorders. You can check your understanding of today's video by going through our key focus question and checking those essential vocabulary concepts on the right-hand side of the screen. Before you close out, make sure to check the answers to the multiple choice questions on the left-hand side of the screen.